everybody. Welcome.
Welcome to all the attendants, the ones that are online, the ones that are with us here in Barcelona. I believe we are around 300 people gathered together for this event. My name is Victor Hernandez. I'm a plastic surgeon based here in Barcelona. And first of all, I want to thank Institute Barcelona for the invitation, and also AMEC, this great center, this all-in-one center, formation center, medical treatments, just a great center to organize this event, and also to share with all of you our experience, okay? Let's go with the presentation. As I said, we are going to talk about reduction of facial and body skin flaccidity, or if we say it in another way, our approach for non-surgical and body and face skin flaccidity using mesoceuticals in combination with radiofrequency, fractional radiofrequency that are going to be applied with micro needling. First of all, a quick revision of the basis and current trends about this type of treatments. Let me tell you about there is a great increasing demand for these non-invasive treatments in our sector, and we should provide this type of treatments because there are many people asking for them, okay? Companies in general are aware of this fact, so we need to take advantage of that because they are doing great investments, and in terms of innovation, development of new technology, and we need to take advantage of that. By the way, I have no disclosures. I'm just a user of this great technology that we are going to talk about, and a great fan of these products that we are going to talk about of laboratories BCN, Institute BCN, okay? So as for every treatment, okay, we are going to assess our patients, okay, in terms of phototypes, in terms of type of skin, in terms of aging process signs, as always. First, clinical study, medical clinical history, just to try to avoid any complication, okay? We're going to assess if the skin has pigmentations, wrinkles, and flaccidity, okay? That's what we're going to talk about today. The lack of support is something that should be addressed in many occasions, looking for correct this volume, volume loss, okay? As everybody knows, you all are experts maybe, and you have many experience in facial treatments. We have many options, and this what we are going to talk about today. It's another option, okay? Another option that should be considered to provide our patients the best solution, because there is not only just one treatment for each patient, because there are many factors involved, so we need to address many of them. So, very important, the medical support, the healthy habits, okay? It seems something that it's not really important, but it's really important because it's the only way to provide, to guarantee long-term results, okay? Our patients are doing great efforts, physical efforts, economical efforts, and we need to involve them in our therapeutic process, okay? Because they are also responsible of the outcomes. So this is really important. Sometimes we forget about it. We need to provide great results in a quick way, but this is what we need to support, okay? Healthy habits, dietetic good conditions, and a great cosmetic support that the patient needs to take care about, okay? So we have mesotherapy, we have neuromodulators, we have fillers, threads, fat grafting, energy-based devices in every, in all characteristics like laser-based, radio frequency that we are going to talk about today, ultrasounds, and now we also have more, developed fractional plasma, okay? When we talk about body, it's just the same, okay? The assessment of patients, give important what there is, what's the problem, okay? About superficial layers, if there is the lack of volume, the deep layers, all of these factors are involved in contour, in body contour and body definition, okay? So we talk about skin, condition of skin, if we got aging signs, adipose tissue, areas, the three things are involved: skin, adipose tissue, and muscle. And all of these conditions should be addressed. Some patients need more involvement about skin, others adipose tissue, but all of them will need to take care of these three factors. Also, many options for body approach in a non-invasive manner, okay, taking on account what we just talked about, the dietetic support, the healthy habits, and physical training. And we also have mesotherapy and also energy-based devices that are providing us long-term results in terms of adipose tissue, because these devices now, as I said before, are really developed, and they are giving us long-term results, permanent adipose tissue reduction in a non-invasive way, okay, using temperature, burning tissue, or in a way of freezing, but both of them giving permanent results, okay? This is something that could be the main topic of another lecture, okay? So let's talk about what are we going to use today. And we are going to use a product. Don't forget that we are talking about a treatment that it's regarded as intensive assisted mesoceuticals delivery, okay? That involves everything, okay? We are using drugs, products, chemical products with those characteristics, okay? Products that are going to be applied in soft tissue, products that are active ingredients, okay? Manufactured under sterile conditions with no additive of perfumes, monodose to provide safety, with proven effectiveness, and can be combined. That means that can be customized, because as we talked before, or we were saying before, there are many things that should be addressed in the great number of patients. In this event, this learning event, we are going to talk about this product, from Institute Barcelona. It's a product that is called BCN Tensis. The composition is about peptides, okay? And we need to know that all these products are done in as I said, in sterile conditions, and their components, okay, in this case are to address the skin flaccidity in terms of collagen stimulation, and also try to provide the substances to obtain skin retraction. We are talking about hyaluronic acid, collagen, organic silica, DMA, vitamins, and minerals. All of them together will provide the best conditions, the best stimulus for the skin to retract. Talking about energy, okay, we are going to use a device, a fractional radio frequency device, and we are going to provide the drugs, we are going to deliver the drugs with microneedling. Microneedling that have these characteristics, okay? We are delivering heat combined with chemical products, okay? And the synergistic effect is what we are seeing that are providing us the best results. Intensive fractional radiofrequency means that we are applying this energy right into the dermis, okay? Through the skin, avoiding the superficial layers, avoiding complications, okay? And going directly to the problem. The handpiece is made about 25 micro needles, okay? Non-insulated ones. That means that all the micro needle provides energy in all the journey up to the point that we are going to apply the maximum amount of energy. Gold-plated, okay, and they can provide us getting up to 5 millimeters deep into the skin area. Quick revision about treatment protocols. All of the patients are going to be provided with a topical anesthetic cream that is supposed to be applied an hour before the treatment. When the patient comes to the center, when the patient comes to the clinic, we provide them with another treatment. We repeat the application with topical anesthesia, and then we just follow on with trying to get the best conditions with antiseptic solutions, remove the rest of topical anesthesia, and proceed to the markings to see where are we going to apply the treatment. Treatment protocols. Those treatment protocols are the ones that they are mainly used, okay? But try to think about that we need to provide this treatment in terms of patient, okay? The protocol, the patient does not, go to the protocol. It's the protocol that goes to the patient, okay? So the protocol should be applied in terms of the characteristics of the patient, okay? But if we know to know about the standard, okay, treatment protocols, we are talking about applying in the inner thighs this amount of energy during this is the time that the microneedling is delivering the energy during 110 milliseconds into this depth, 2.5 millimeters. We can see here in this anatomopathologic photograph that we are going to apply the energy in the reticular dermis, that we are not going down 6 millimeters. We are not going, just here in this area, from 2 to 4 millimeters, okay, just to provide the energy here, and the effect that we are going to obtain can be reflected in the superficial layers, okay? So we are going to do two times, 2 passes on the same area, and we believe that 3 sessions, 1 per month, are the best, the best numbers to get the good results. 3 sessions per year, just to maintain the results. And we are going to use 5 milliliters BCN 10-cis peptides. Okay, those characteristical treatment protocols are about facial, okay? The ones in the inner arms and inner thighs, okay, are almost the same, okay? This is 14, maybe, it's not 18, 14 watts, okay? Depending also the sensitivity of the patient, okay? If the patient feels pain, we should lower energies, because we need to provide the patient comfort so the patient repeats the treatment, because if the patient gets lots of pain, he will think about coming back. So 10 milliliters of BCN intensive peptides to be applied 5 milliliters for every inner arm, or 5 milliliters to every inner thigh. Okay? And I repeat, these protocols should be reconsidered, depends on the patient, because not every patient is the same. Post-treatment protocols apply cold pads. We also recommend a BCN heel cream that is specific for microneedling treatments, that provides, a nice effect to the patient, reduces the redness in a really short period of time, and we recommend the patient, okay, to maintain this product at least twice a day and combine with creams with sunscreen. Let us say also that this treatment is not season dependent. That means that the treatment can be done during the whole year, okay? The only recommendation is not to go right into the sun for the first week, but they can do sun exposure in daily basis. There is no downtime. That's what the patient is looking for, to maintain, these normal daily basis activities. So let's go through some clinical cases. This patient is the one we are going to treat now live. This patient is already got 3 sessions, okay, because her concern was this submental area. I hope that it can be seen, because I cannot see it real well, but I hope you all guys can see it. The improvement on these lines, okay, that we can be compared 3 months after. There are 3 months difference between this picture and this one, okay? 5 years ago, 6 years ago, there were not many options for those patients, okay? Maybe those patients, the first option would be surgical 5 years ago. Now, these patients that they don't want to go through a surgery with downtime, with lots of efforts, risk, money investment, etc., they can get these results with a non-surgical approach. Profile view, how we improve the angle also. We should remember that the more sessions we are going to apply, the better results we are going to get, because we are going to improve an area that has already been improved. So the results, if maintained, if the treatments are maintained, they are going to improve. The same lady that we are going to treat afterwards, okay, that was concerned about the inner aspect of her arms, okay. As I said before, 5 years ago, 7 years ago, the only solution was an arm lift with a very long scar into this area, not visible pretty much because the patient should raise her hand, but we can see that with a non-surgical approach, with a non-invasive approach, we can get good results, and patients, okay, need to know that we got this option. The other side, we are talking about not improving the volume, the amount of adipose tissue that is around here. We are talking about improving the skin aspect or the skin quality. If we want to go and improve the adipose area, we should use maybe the same technology, going deeper, and with lipolytic products that can provide, a solution to this amount of adipose tissue. Another case, Some people will say that there is not much difference, but I can see there is difference, and the patient says and can see that there is difference. That is what it's worth it, what we are looking for. Okay, the patient is satisfied. The patient obviously these inner thighs are not good candidates for surgery, because the scar we are going to leave is not going to be worth it. So instead of telling the patient, you don't have any chance, no solution, we can provide this treatment to get a good result, but also explaining and taking care of her expectations. It is really important. Don't promise what you cannot do. And I want to finish the presentation showing a case. It's not a usual case. It's what we call a massive loss of weight after, treatments, about surgical treatments or great diets, okay, that, causes, okay, this hanging or this sagging of the skin, okay. This case is not only with radiofrequency. We need to approach these cases from all point of view. Between this picture and the one on the right, maybe there are 6 months of difference, okay, using muscle sculpting technology to increase muscle, using traditional radiofrequency to address the sagging skin, and also radiofrequency, fractional radiofrequency, microneedling with BCN tenses. And this patient is a patient for a long life. It's going to come and wants to get better and wants to give, needs a follow-up, because there's no way to maintain this if the patient has not the good protocols in terms of long-term results. And that's all. So whenever you want, we can go to the other room, so we can do the treatments that the patients are already prepared for. Present you the patients. We will do the markings and we start. Okay, every treatment takes like 30 minutes, 45 minutes. Okay, it can be done by the doctor, by the assistant. You don't really need 2 persons to doing them. Okay, it helps to have some help, but it's not really necessary. Okay, and we will do this patient fascial. This patient of fascial treatment that we've seen before is going to get her, follow-up or her maintenance treatment. We propose her to get the treatment 3 times per year. So she's now getting her first maintaining treatment of the year, and also the following one, that is the inner arms, okay, is the same situation. They have improved and they need to maintain the results and also increase the results in terms of good results. Okay? Yes.
Thank you so much for your presentation. I have the first question. Is it okay to treat the areas first with microneedling and after with radiofrequency, same session?
There's no problem. You can go ahead and do it. The patient won't feel any type of pain, but maybe in terms of, not bothering the patient that much time, I wouldn't recommend to do it. I would prefer to do the microneedling, let it heal, and after a month, provide the patient like a protocol of traditional radiofrequency to get better results. But it's no problem. There's no problem about it.
Thank you so much. At the moment, we don't have more questions. Please, all our participants, don't raise your hand, just write online your question.
Maybe we can go ahead with
Exactly.
the treatments, and during the treatments, if any question comes up.
If you have, look, yes, I have another question. Excuse me, can I use traditional radio frequency?
You can use traditional radio frequency, but this type of patients won't get these nice results just with traditional radio frequency. You can use traditional radio frequency with this type of products, but the nice effect, the great effect comes with, this transdermal application, get the product into the skin, not through the skin.
For your reply, doctor, at the moment we don't have another question. Another question. Thank you from Maryland. Please, our participants, if you have the questions, you can write online, and we can reply directly. If not, you can think and write the questions in the chat, and then we will read them. Another question from Catalina. When can I put tensis peptide in this type of treatment?
When? BCN peptides, tensis, its indication is to improve aging skin, sagging skin with laxity. So there's no problem in any area to apply this product, okay? If you have the necessity to improve skin aspect in terms of wrinkles and sagging, it's perfect.
Much, doctor, but I think maybe Catalina connected a little bit late, and maybe she didn't hear that we use tensis peptide together with the equipment.
Exactly.
So maybe her question was, when should I put in the protocol? So
okay.
we apply.
Good questions, because I didn't go through that. Before going into applying the radio frequency, we apply in the surface of the skin a good quantity of product, okay, and we will deliver it at the same time, okay, looking for this synergistic effect, combining energy and chemical solution, okay, and both of them will act together, okay, and will provide better results if compared to one by itself.
Thank you. Another question from Rita. Is it good to use infrared after microneedling?
Good. Good comment. There's no contraindication. You will provide the patient a better evolution, okay? You can get less redness, but don't forget that this treatment is not going to suppose to the patient or mean to the patient that they are going to have, like a great swelling or a great inflammation, a great redness. But it's no doubt about it, you can apply it to increase the comfort effect.
Thank you so much. We are waiting for more questions.
Mm-hmm. So in the first patient, we will go all over this area that we have improved already. We will mark the submental area, and I feel that it's a good idea to go a little bit on the jawline, okay? There's not that much hanging, not much flaccidity, but also we will get an improvement. The picture, we can see that there is also an improvement, okay, in this area. So at the same time, try to apply the treatment by areas, okay? Submental, jawline, marionette could be also a good. There is no sagging, But if you use radio frequency, you will get some collagen stimulation. And the key point is provide natural results, natural good results, because many years ago, or still nowadays, we can see, that there's still some people trying to correct flaccidity, aging skin by applying volume. Okay, it's a spectacular effect in the short term, but in the long term, we're going to get probably unnatural results. Okay, and people looks like kind of not satisfied about it. Yes, next question.
One question from Carol. Hello, interesting case review. I have a question. How often is it advisable to apply microneedling session?
Okay. Our protocol, our standard protocol, okay, is when a patient starts this treatment, try to get her or get him to get 3 treatments, 1 every month, okay? But this is not something that should be taken as something that should be done this way. Depends on the patient, maybe. What we can see is at the beginning, if there is no such a long time between sessions, the results are, kind of better, okay? But after that, depends on the patient, depends on the habits of the patient, depends on other treatments that the patient are taken. You can delay the treatments, okay, from, 2 months, 3 months. But in the beginning, to start, the recommendations are to do 3, 1 every month.
Waiting for some other questions.
I believe that another key point to consider is not to apply energy in the deeper areas. We need to get the technology to provide the energy in the superficial layers, okay? Because when you are treating hypodermis, maybe the sagging effects is a little bit more evident because you are treating, adipose tissue. And as we said before, the lack of volume, the loss of volume is something that should be addressed, not, get it worse, by melting, this adipose tissue that is underneath the skin. So get the technology, whatever you have, but apply the energy between 2-4 millimeters, okay? When you are talking about other areas, maybe you can go deeper, but the areas we are going to treat today are, the characteristic is that they don't have too much, you don't have that deep or this kind of skin, okay, that it's like, for example, in the back or in other areas like the rest of the face, for example, the malar area. You can go deeper, but be careful with that issue because you may have another, effect that is not that you are not looking for.
Doctor, one more question from Rita.
Yeah.
She shares her protocol because she is also the user of the Institute BCN products, and she says her usual protocol consists of cleaning the skin, exfoliation, then microneedling, and then she uses infrared and facial EMS. And her question is, do you think that fractional radio frequency with microneedling would give me better results?
Well, I'm positive. I'm positive because you are delivering energy where you need it. I mean, in deeper layers, okay, and you are combining it with this product that it's clearly, okay, an anti-aging product, okay. It's a product that provides skin tension. So if you have the opportunity, I recommend to use it, okay. Try to provide your patient with your protocol, okay. And if you apply radiofrequency with microneedling and other technologies, you are going to get better results because you are addressing the situation in different aspects.
Please, our participants, be active. Don't be shy, because you just need to write the question in the chat. There is no need to pronounce it, and we will obtain the reply from the doctor. Please be active. Thank you.
Okay, so should we proceed for the treatments? Okay.
We have the device, ready for treatment, okay, with the parameters, okay. As you can see, you can focus. You have the default proposal of the company, and then you need to try to get the best for your patients, okay. Now we are going to work with a power of 14 watts in it, and we're going to deliver the energy at 2.5 millimeters, okay. As you see, we have a single-use microneedling device for each patient. You see the tip, it's got into the handpiece, ready to be used. You have your foot switch, and you can see how the needles work. Okay, let's show it to the audience and how the needles come out. Maybe in this way. You can get close the camera, great. Okay, you can see the needles, okay. As you can see, the company provides with an sterilized product, okay. You don't need to clean it because it's already sterilized. If you got a good trained team support, okay, this treatment can be 100%, it can be done by your team members, okay. You just need the training, so it's really a good idea to have this option for your patients. We got the 5 milliliters. We apply, I do it this way, but you can do it the way you feel like doing it, okay. Use some of the product, you get it all in the area. And we'll start. I like to stretch the skin, and we are already, as you can see, we have the product in the surface of the skin. You just need to, to keep an order, following your lines, applying perpendicularly the device. The device does not make such pressure against your arm. If you work deeper, you may feel something. I like to apply it in a row. First a row for a, going to use continuous way. Let us see. You can go faster or not that fast. Now I'm pressing my foot switch without taking out my foot out of it. So you can do like 1 shot every second. You can see the patient is not having a really bad time. We are going to do 2 passes all over the area we want to treat. For me, the key point is to maintain the skin stretch and apply the microneedles in a perpendicular fashion, so the energy is delivered in the best way, symmetrical and really nice. You see the skin is getting a little bit red. Maybe you can also see the spots of the microneedling. These spots will go away like in 48 hours, and the patient with a little bit of sun cream, with sunscreen, with a little bit of fluid makeup, will not have any problem to do whatever she needs to do. As I said before, a little bit more of product, please. Thank you. I'm going to apply some in this jawline also, just to maintain, you know, the treatment by areas, to avoid the so ever called footprints, okay, differences between treated areas and non-treated areas. So the patient is not suffering many pain. If the patient is concerned about the pain or is telling us that maybe we should low down our energies, but it's not the case. And then we are going to go for the second pass. Second pass is done almost the same way, okay? You will see that many doctors may change the depth in the second pass, okay? I sometimes do it because, you know, applying the energy in different layers is not a bad idea. So in this case, with this thin skin, I will apply the energy a little bit superficial, and I will go 2 millimeters in depth. Same energy, a little bit more superficial. Afterwards, the best thing to do is have someone of your staff and make the rest of the solution to be absorbed by the skin, providing the patient a massage on the area that will be also relaxing for her or him, trying to provide also your patient with a good experience, okay? The patients come to our clinics to get really good results and good experiences, so they will look for to come back. You can, if you overlap your shots, it shouldn't be that a problem. I also like to go through these wrinkles, these perpendicular wrinkles. If you have these wrinkles and you don't have this sagging skin, you may use the same procedure using a product like with hyaluronic acid to provide, you know, some filling effect in these areas that they are not sometimes a good area to treat with hyaluronic acid, because you may feel the product, okay? So we are almost done. We have some product left, so we can
have somebody, you know, to get some more time, you know. At the same time, we can be, you have the next patient, okay? Do we have some cold pads? So this is the immediate aspect of this treated area. As you can see, this patient has really, you know, something that is not going to be a problem to continue with her normal activity. Maybe now, if you feel like doing it, applying some, you know, either low light laser therapies like red light, or also applying with this, if you have some product left, apply traditional radiofrequency, okay? It shouldn't be a bad idea if your center activity allows you to do so. The patient will appreciate it for sure. Now we are going to apply some healing cream, as we talked before, the BCN heal, that it's just made for this type of treatment, for microneedling care or microneedling after care. And after that we are going to put, no, do we have some? Okay, cold pads. If the patient needs to do so, maybe she could use some makeup, some fluid, you know, like some skin cream, some cream with, you know, sunscreen with some color. Okay, we are done.
Thank you, doctor. We have just about this.
Okay.
We have several questions.
Okay.
The first question is from Mirella. How often can we do the microneedling radiofrequency after 3 recommended sessions?
Depends on the patient. For example, this type of patient is taking between 3-4 sessions per year. Okay, one session every 3 or 4 months. Okay, we have the good chance that this patient has really good habits. Non-smoker. She likes to keep her, you know, with nice cosmetic products, and she comes often to our office, okay, and get some other treatments. Maybe if the patient is this type of patient with 2 treatments per year combined with other treatments, also you could get a nice result.
Thank you so much. And one more question from this participant. How about working in the thyroid?
We don't go back, we don't go down the area of the thyroid, okay? We just keep upwards.
Okay, thank you. And another question from Marina from Canada. Are there any contraindications for using radiofrequency on the neck?
Try to avoid, as the previous answer says, the thyroid area, okay? And also in general aspects, patients with pacemakers. We are not going to use radiofrequency on patients that they are wearing a pacemaker. But for the rest, also maybe could be a contraindication if this patient had some kind, you know, of metal device, like for vertebral instrumentation, okay? Shouldn't be the patient to use radiofrequency on, okay? But patients that has also teeth areas treated with implants, there are no problem to do that, okay? You can, maybe they can feel some type of sensation, but there's no problem.
Thank you so much.
This product, it comes on boxes with 5 ampoules, okay? So you have plenty of product to treat not just the patient, but maybe 2 of this type of patients, because as I said before, you just need maximum between 10 20 cc's, not much more. Okay, so we're going to remove the rest of topical anesthesia, and we are going to do our markings just to keep really in the area we want to treat. You see, this patient maintains the good aspect of the skin quality. It still has some volume, but be careful with the volume, because when treating the volume, sometimes we lose, you know, this kind of or the sagging effect could be worse. So keep really close to the superficial layer so you can get this inner arm better by improving the skin aspect. Okay, so the area we are going to treat is this one. As I said before, 5 years ago, 6 years ago, we could not offer much more treatments to this patient, and the option was a surgical approach with a scar all over the inner area that in most cases the patient does not want or feels that it's not really worth it. Okay, let's go to the other side. Remove, clean the area, really clean. It's not invasive treatment. There are no wounds at all, but maintain this area as much clean as possible. Okay, so we are talking about maybe a 3 by 6, 7 centimeters. Okay, we already changed our tip. Okay, it's a new tip for a new patient. So I already changed my parameters. Okay, we are going to use 14 watts. We are in the medial range. Okay, we are going 2.5 millimeters, and the pulse width we are going to use 80. Okay, or maybe we can use 110 to be a little bit more invasive. Okay, because we are going to keep the heating a little much more time. Okay, let's see if in this way the patient can, you know, does not have that much pain. Okay, the best way to do that maybe is take your patient with her arm in the back of you. Okay, and may I have the tenses, please? Let's apply the product in the area you are going to treat. You see, it's not really fluid, it's a little bit gelatinous. Okay, so it's easy to handle. Spread it so it keeps in the area, and we are ready to start. The stretching effect on the skin allows to apply the energy in the surface that you are looking for. You leave it loosey, you don't maintain the tension, it's not that effective. So we are going to start. The patient is not feeling that much pain. Don't forget the concept about this treatment. We are delivering, okay, the product, okay, through the microneedle points. So we are having this synergistic effect, combining energy and chemical effect. There are many people that believes or think that if you are heating the product, you are losing effect. I'm not 100%. I don't 100% agree with this statement, because there are no studies about it. You know, this we are talking about heating, but not that much heating. So, and the results show that the effect of combining the two treatments, the two ways of applying collagen stimulation, really work if you compare just with one. As I said before, let me repeat some of my comments, because sometimes people join us later, or maybe they have missed some point of the webinar. So I will let you know, I want to let you know that this treatment is 100% delegable. You can delegate this treatment to somebody of your team with a nice training. There should be no problem. You can see the counting of the shots. We have already made 50 shots. Okay, I usually do between 200 to 300 shots per area, and as I said before, sometimes I change my parameters between one pass and the other one, trying to get the effect in the whole deepness of the skin. As I said before, maybe if our idea is to get this fat tissue removed in some way, the only thing that we should consider is that it should be done in a slow manner, okay, to avoid this hanging or this losing this or get the flaccidity worse, okay, by treating the adipose tissue. Maybe we could use some of the lipolytic products of the company's portfolio that somehow they treat the adipose tissue and deliver the energy like in the deeper area, like 5 millimeters down the skin with this lipolytic agent product. So you see we have this redness. Should be, I believe this is the end point that we always look for, this type of redness, this type of, you know, little marks on the skin. If you get much more redness than that and you get some bleeding of the area, I should avoid that, because then the possibility of infection, the possibility of complication, scarring kind of gets bigger. We are almost done with the first pass. Let's move on. Some more shots on this area. Keep the stretching effect on the skin. Keep the needles perpendicular. As I said before, you can also treat all kinds of phototypes. Okay, try to avoid, you know, high energies as always in high level of phototypes like 4 and 5, but it's a safe treatment. Okay, first pass. Okay, let's go for the second pass, and we go a little bit superficial as I went before in the previous treatment. 2 milliliters. The area that is close to the axilla, it's always, you know, the one we want to. As you can see, the treatment can be done by just one person. Don't bother if you overlap some shots. You won't have any complication as soon as you are, you know, getting this endpoint on the skin. Redness, a little swelling, but no bruising, no bleeding. If you get some bleeding, it's not an issue anyway. You are being a little bit aggressive, but you know, it's the way you like to work. Okay, I believe more in, I prefer to offer 3 sessions to my patients and try to avoid complications and try to maintain the possibility of the patient of do whatever they want after the treatment, rather than do one session in an aggressive way and keep the patient a little bit, you know, concerned about the post-op or avoiding some type of activities. And don't forget the concept about the intensive drug delivery method that we are applying. For me, the best thing about both approaches, the chemical and the physical approach, the radiofrequency and the drug delivery treatments, is that you can treat many issues, many types of things, from scars, stretch marks. We provide this treatment to our surgical patients to increase, the collagen formation, okay, in our recent scars. And don't forget, the rejuvenation you are providing, in a non-invasive way. I'm going to get close to this area with some shots. I always try to keep during the treatments on my screen the pictures of the patients, so I can see, the before and after treatments, so I can, see where does the patient need more aggressiveness or more treatment or more energy or more passes. So you see here, close to the axilla, I'm doing a third pass. Okay. May I have some more tenses? Because we're going to use these channels that we have already made, to keep this. Okay, if the patient goes home, I sometimes propose them just to leave the product until the next day and not shower, okay, until the next day, because this is going to do some, we are using the channels that we already done. If you see a little swelling, this is the endpoint we are looking for. You can be more aggressive. Yes, you can, but if it's the question, if it's really needed. May have some gauze, so we can put it here. Let's go to the other arm. I'm going back with my previous parameters. Remember, 2.5 millimeters, 14 watts. Okay, let's go. As the more experience we get with the products, with the technology, the farther we are going, because nowadays we are applying this technology to capillary, or to prevent hair loss, to treat hyperhidrosis, axillary hyperhidrosis, okay, getting nice result, medial term results, not long term but medial term, with, for very important, no downtime, no pain for the patient. Also a nice field that we are applying this treatment is to treat melasma, combining microneedling with tranexamic acid, but not applying heat. We just use the microneedle to deliver the tranexamic acid, to these areas that has this excess of melanin in a deep layer. So this melanin that is not, you cannot get that deeper with lasers of chemical pills. You have this option now. Get not the tranexamic acid into deep layers with this technology. As you can see, the redness is not that evident. So taking on account the questions we got before about red light, low light laser therapy. It's not bad, but the redness is not that much, okay? The uncomfortness of the patient is not that evident, so we don't really use it, okay? What we really recommend is, the moisturizing, the repairing cream, because that means that the patient will increase the result. If you in some moment you want to combine this treatment, for example, with some kind of treatment that maybe you are thinking about threads, you are thinking about products that you can infiltrate, looking for this collagen stimulation, at least wait 1 month between treatments. That's my recommendation. Do we have any questions from the audience?
Yes, we have one question.
Okay.
Can a person who has a cardiac stem have fractional radio frequency done on the face and body?
Fascial stent. Well, it's a patient with a cardiac, issue is not the type of patient that we really look for in our clinics. So maybe it's not the best patient you could, look for. But I believe that it shouldn't be that an issue, because the stent, is far away from the area you are treating, because you are not going to treat thorax, you are not going to treat pectoral area. So, but I try to avoid this type of patients.
Thank you, doctor. Thank you, Daniel.
Second pass. If then you apply a nice post-treatment procedure like some massage, some low light laser therapy, etc., that means that you can get this treatment done in 1 hour. Another thing that I always recommend is to propose the patient to take some complements, okay, like collagen, like vitamin, combinations, taken it orally, just to provide more, effect on the area we are treating. Patients that get the treatment, when they get better, if they start, because they feel like doing it, some type of diet, some type of, exercise, training, most of them, they get much more improvement after the treatment compared to the effects that they were getting out of the same, training or diets, okay, on the area. Because as the area has improved and has, this collagen stimulation, okay, they kind of react better to this, exercise of, diet. What is really important is to have the support of your company. The company should be concerned, should be, really involved, with your activity, because if we want to get the best improvement, the best results out of, this type of product, this type of technology, is really important for me. It's the most important thing to have the company behind you, pushing you, proposing you new protocols, like, because it's the way you get out the best out of the product or the technology. I'm going to do a third pass in this area, because it's where the sagging, I feel it's more evident. So we are done. Let's put our cream on, repairing cream. You see, almost, you see the effect of the microneedling, okay? Sometimes this endpoint, this red endpoint, when you see the patient The next day, maybe they get a little bit brown, okay, because of the healing process, okay, but it's not really a wound. It's just, a little, papula, okay, on the skin, okay. I mean, this is a nice endpoint, rather than bleeding, okay. You can make you feel like make your patients bleed because you get much more effect. It's something to be considered, okay, and to talk about that with your patients, okay. They can shower the same day, they just use the cream, but I recommend not to shower the same day, okay. Just leave it up to the next day, 24 hours, because you get much more effect of the products. Okay, well, we are done. Thank you. We are with our next patient, okay. This patient is concerned about her inner area of the thighs, okay. Be careful with this type of patients because they don't look that bad. So when they get better, they don't get that much better, okay. You can improve, okay, but be careful with patients' expectations because you cannot get out great results. Excuse me, you can get great results out of patients that are real, they are not real in a bad condition, okay. As we can see, this patient is really in a good shape. She is slim, okay, no weight problems, a nice type of skin. So this treatment will get better these areas around here, okay, because they are going to increase tension, okay. But be careful because the before and after are not going to be that spectacular, okay. So if we transmit this to the patients, that's no problem. And the indication to do this treatment, apart from getting an improvement, okay, is to prevent sagging, to prevent laxity. So it has both indications. Treat these small areas of concern, but try to prevent the the aging process to affect this area that it's really an area that sometimes it's an issue for us, okay. So we are going to change our tip. We are going to take out the rest of topical anesthesia. Okay, we can see that we don't have that much fluid retention, so this is a good thing to take on account because the result is better, okay. So we are going to treat from this area, from this line up to the middle line, okay, just to get an improvement in tension. But as you can see, you can get improvement, but not that much, okay. But it's nice to use it because it's a preventing treatment, an anti-aging treatment, okay. So it has this indication in this patient, okay. So you can lay down. We are going to change our tip, so there is no type of mistake. Let's go back to our parameters, okay. We said about using 14 bats, 110 milliseconds of pulse width, okay, and we'll start going 2.5 milliliters deep, okay. So we are going to use our product. Let's see, if you feel any pain, you just tell me, okay. Providing tension to the skin. Let's start. Maybe we are facing one of the more sensitive areas, okay? The ones that in the inner thighs, close to the perineal area, okay? So it's not a really uncommon situation that patient does feel a little bit uncomfortable, but at the same time we need, you know, to provide the best effects. The closer we get to the thigh, the worse for the patient. Another question we do often get is when do patients start feel they got any result, okay? I would say that only half of the patients feels that they are getting improvement after first session, okay? The common things is that they get results more after second sessions. Going back to the issue about the bleeding effect, I would say that the areas that, you know, you may try to get some bleeding are the areas when treating, for example, acne scars. When you do acne scars, you need to be more aggressive because the scar box, the ice pick scars of the acne are most of them, they are really deep, okay? So when you get this treatment, you bleed in many sessions, okay? The cream works. And I would say it works better in this area because the skin is much more thin. I've already done almost 200 shots. This is a little bit bigger area. As you can see, we are getting the same endpoint compared with the rest of the patient, the redness, the little papilla swelling process, okay? If you have the technology, the proper product, it's not a difficult treatment. It's the point is to find the good candidate, explain, invest time explaining what can the patient achieve, that the great results and the long-term results are based also in patients, okay, attitudes. So as you can see, the area that is close to the thigh, it's a more sensitive area and suffers a little bit more, you know, gets a little bit more red and a little bit more swollen compared with the rest. You don't need to make a great deal of pressure on the skin. Just keep, you know, in touch. You will feel that the handpiece tries to sometimes works against you because you get it back, but you don't need to apply lots of pressure. It's easy to contain. We're almost done with the first pass. So we are going to change our parameters. We are going to work a little bit superficial. Same power, same pulse wave, okay? Just a little bit superficial. In following session, it would be a nice idea, maybe if the patient don't feel that pain, to increase a little bit power. As you've seen in the previous presentation, we kind of work between 14 watts and 18 watts. So it's a way of working that you can be increasing if the patient, has a well tolerance. Tolerates the pain or don't have that much more sensitivity. Okay. Some areas in the treated zone, they don't feel, doesn't really mean that you didn't go over these, for example, white areas, but it's not too bad. Like, try to go, over the areas that are not that red. Maybe you didn't make that pressure compared with the rest, and it's not bad to go over. As you see, I always maintaining pressure, stretching. Here it's a little bit more sensitive, is it correct? Mm-hmm. Okay. You see the result, the effect, you see? More sensitive areas, they get a little bit red. This is the endpoint, okay? Redness, a little, swelling. We go back to 2.5 millimeters. When you do your pinch test, you can kind of try to get what is the thickness of this skin. Okay, a pinch test that we are talking about, maybe with a caliper, you would get like not more than 2 millimeters. Okay, and we are talking about a pinch test. So that means that don't go under 2 milliliters because you don't have that much skin. So the superficial you go, the more effect you will get. There's also a really, it's not another question that we sometimes get. Why don't you go much more, up with your power, like, 20 or 22, stuff like that? Well, because we don't see the difference, okay? Because as you are not facing, a severe problem, why do you think about using, high energies? Okay, just try to get the proportional effect. When we talk about like higher energies, about 20, 22, we are talking about what I said before, like acne scars, or when you're gonna go down the adipose tissue and burn fat, okay? But be careful with the skin. We are close to 400. So that means that inner thighs, maybe you will need like 400 shots, 2 per side, 200 per side. Okay, that's the other side. We are getting this, this redness. Something that, takes some time to appear. It's not immediate. Let's go to the second pass. I believe this type of patient, slim patients with this thin skin, I would go rather the more superficial, between 2 and 2.5, between 2 and 1.5, rather than 2, 2.5. Let's go on. With this movement, you have yourself moving towards you the skin excess or the skin area, and at the same time you maintain tension. For example, now I'm not giving any pressure to the handpiece, okay? And the micro needles, like easily slide into the skin. I believe this technique is more efficient in terms of applying the product also in a more homogeneous way, rather than infiltrating solutions here, because you don't, kind of get the effect in the whole area in a, the same way. We are getting close to the end of the treatment. So if you feel like making any questions.
One question from Donna, Croatia, and the question is, if I understood correctly, the result for inner thigh is better if there is less water retention. So my question is, why?
Well, because the energy with the less fluids, the better interaction with the tissue, okay? If you got fluid, okay, you won't feel that this effect on the reticular dermis is good enough, okay? Because remember that when we talk about cellulite, we talk about fluid retention in superficial layers, okay? So the less fluid, the best effect on flaccidity, okay? Not only with this treatment, but with many others. If you have cellulite, you may use, okay, this type of treatment by using other products, okay, with no energy, for example, only to deliver the product in deep layers, okay? But nowadays, for cellulite, we do have other techniques based in other products, okay, that are, infiltrations, like with needle, no microneedle, that combined with other treatments seem to, you don't need to, to use this type, but it also works in some patients with not severe, cellulite problems. Okay, we are done. A little bit more of product, okay. I always recommend not to shower the same day, okay? Just because you will get much more effect of the product, in contact with your skin for the next 12 hours, rather than remove it, because, these little holes are still open. So that means that all the product you use, the cream you will use, when you get at home to avoid swelling, to avoid redness, it will be more effective if you don't shower right away. So thanks for your collaboration.
We have a question from Carol.
Okay.
She is asking if, for example, we want to treat periorbital area, what would be the protocol? Will it be the same number of sessions to be carried out?
Well, I would say that the protocol is very similar, okay? The period between sessions, it's very close to 4-6 weeks, okay? Because sometimes, it gets a little bit more of time to the skin to be repaired, okay? Maybe we can change. The parameters are different, and the more because you need to be more, you don't maybe 10 baths, 80 milliseconds, okay, of pulse duration, okay. But we would use some Botox-like product, like argireline, to use combined with the radio frequency, okay, just in case we want to get a better effect on mimic wrinkles or expression wrinkles, okay, or also to increase the effect of neuromodulators when you, for example, feel that you don't need to apply 2 sessions per year in the same patients with neuromodulators. You can combine radiofrequency with argireline, what we so-called Botox-like substance, okay, just to provide a more longer effect on patients. Okay, but the pulse, okay, duration would be more or less 80 milliseconds, 10 bats, okay, and I would go like 1.5 milliliters, not that much, between 1 and 1.5 millimeters under the surface.
Thank you so much.
Thank you.